a fundamental understanding of the core principles and approaches utilized by epidemiologists shall be examined. These are critical to the study and practice of public health in Canada and abroad. Now, let's begin our learning journey.
So let's begin by first defining what epidemiology is and its word's origin. Well, epidemiology is actually derived from various Greek terms. Epi refers to meaning on, upon, or befall. The word demos is the root meaning the people. And logos, of course, is a suffix that refers to the study of. Epidemiology really serves as the foundation for public health globally. So what is epidemiology? Well, we define epidemiology as the scientific study of the distribution and determinants of health-related states or events in human populations across the lifespan, and the application of this study to maintain, control, and prevent alterations to health and well-being. Now, we know, for example, that certain rodents, rats, mice, and squirrels, can carry many types of bacteria and viruses and so forth that can affect human health and well-being. There are two basic types of approaches used by epidemiologists. The first one is called descriptive epidemiology. And descriptive epidemiology is employed when little is known about the disease or health condition. Conversely, analytical epidemiology is used when insights about various aspects of the disease or health condition is known. So what is descriptive epidemiology? Well, we define it as the identification, description, observation, measurement, interpretation, and dissemination of health-related states. For example, is the disease present or not present? Certain events that may take place, such as a chemical spill. We also try to identify patterns, how disease may cluster in certain occupations. For example, in miners, lung cancer and its association with asbestos. Certain trends that may be happening in society, such as aging population in North America and the higher incidence of chronic non-communicable diseases that occur with aging. And or injury, such as work-related injuries, motor vehicle accidents. And we try to look at these in terms of differentials in regards to person, place, and time. So the descriptive epidemiology involves the characterization of the distribution of health-related states or events by person, place, and time. So by person, we're referring to who tends to be affected. Is it males? Is it females? Is it certain occupations and so forth? The place, of course, relates to where this is occurring. Is it occurring in certain environments? Does it occur in water? Does it occur in certain occupations? And of course, the time element is very critical as well in terms of exposure times or the time necessary for a disease or ill state to develop. What is analytical epidemiology? Well, analytical epidemiology seeks to identify risk factors and or social determinants of health that help to explain the causation or etiology of a health-related state, event, or condition. Here you see a picture, a photo that I took in a rural village hut in northern Thailand. And we know that poverty and access to safe and clean drinking water supplies are in fact major social determinants of health. And what happened in this village also, you cannot make it out in this photo quite clearly, but in the bottom part of that, there's a hut on top where individuals actually reside, and then various animals were located directly underneath where these humans where these people were living in northern Thailand, such as pigs and chickens and so forth. And we know that we have to separate animals from humans because there is a higher risk for transmitting various diseases or cross-contaminating here that we'll talk about more in a moment. What are endemics? Well, our endemics are defined as those diseases or illnesses which tend to always be present at low levels in populations in a defined geographical area or region. So things like Lyme disease and chicken pox, for example, is quite endemic in many parts of Europe, in North America, in Canada, and the United States, for example. We know that Lyme disease is transmitted by black-legged ticks that have a bacterium in it, and these are prominent in certain time periods, notably in late spring and early summer. So we want to emphasize prevention, to wear long pants, for example, and to wear insect repellents containing DEET to discourage these ticks from biting you, and of course from contracting Lyme disease, which is endemic in these particular regions of the world. What are epidemics? Well, epidemics are defined as the occurrence of a given disease or illness in clear excess of the normal frequency in a defined geographical area or region. So example might be the West African Ebola epidemic from 2014 to 2016. We know that Ebola is an extremely rare but deadly virus that causes fever, body aches, diarrhea. It may also lead to bleeding inside the body in the various organs and also outside of the body, bleeding through the nose, the eyes, etc. And it can also damage the immune system and organs. During the 2014-2016 epidemic in Eastern Africa, a total of over 228,000 cases of EVD and over 11,000 deaths were reported in Guinea, Liberia, and Sierra Leone. So what are pandemics? Well, pandemics are defined as basically massive epidemics that involve populations in widespread geographical areas or regions of the world. And we had various pandemics over the course of our history. Some recent examples are, of course, HIV/AIDS has gone global, the SARS pandemic, the Zika virus, H1N1, and of course, most recently from 2019-2020 and onwards was the COVID-19. What is interesting here to note is that approximately 75% of all emerging and re-emerging infectious diseases are of zoonotic origin in nature, right? Including things like COVID-19 and SARS. Definition of etiology. Well, the scientific study of all known and suspected risk factors, causes, and or social determinants of health that may be involved with the development of a health-related state, event, or condition, and includes the susceptibility of the individual and the nature of the disease agents. Okay, so we often think of things like bacteria and viruses and various germs obviously leading to diseases, but it may also involve certain social determinants of health like poverty, I mentioned in a previous slide. Also what we're putting into our body. So the regular consumption of high caloric sugary drinks have been linked to the incidence of obesity, type 2 diabetes, cardiovascular disease, and certain forms of cancer. And if you look at here in this photo, there is a pop here, a cola type drink. And if you look at the amount of sugar present, sucrose, it's actually 41 grams. And you can see I put into a small little glass vial there how much sugar is actually contained in that drink, that pop drink. It is a huge amount. The role of epidemiologist. Some of the activities performed by epidemiologists include, but are not limited to, first of all, the identification of risk factors related to disease, events, injury, and death, as we noted in previous slides. We also want to do the monitoring and describing their natural history, identifying which individuals or populations are at greatest risk, and evaluating the efficacy and effectiveness of various primary healthcare programs, interventions, and policies as well. Epidemiologists also seek to describe, quantify, and propose causal associations and mechanisms related to health and wellness in diverse populations. The discipline of epidemiology has a population focus since epidemiological investigations are concerned with the collective health and well-being of individuals in a defined population or community. So one classical study, such as the Framingham Heart Study, which has been going on for for over almost 70 years now, has identified various risk factors associated with the development of various forms of heart disease. And we know one of them, for example, is hypertension. Hypertension is also called the silent killer. You don't know you have high blood pressure unless you actually take a reading and determine your systolic and diastolic pressures. And we know that hypertension is in fact a modifiable risk factor linked to the development of heart disease, to stroke, and also to kidney failure. All right, so let's look at some major historical figures and milestones in the history of epidemiology. All right, so let's begin with Hippocrates of cause. So Hippocrates is, of course, the father of modern medicine. He was a Greek physician and scholar. He was the first to coin the terms epidemic and endemic in his very influential books entitled Airs, Waters, and Places, Epidemic 1 and Epidemic 2. And Hippocrates was really the first individual who attempted to explain disease causation from a non-secular or divine perspective. So historically, it was believed that certain gods or deities were angry with humans and therefore punished them by causing disease or illness. So Hippocrates' theory of disease causation was based on an imbalance in 4 essential body humors, which he identified as phlegm, yellow bile, black bile, and blood. So if the patient, for example, had a fever, they were hot, the treatment was to try to cool them down. Or if there was an excessive amount of blood to be in the body, then phlebotomy may be the intervention, or giving a patient an enema, etc. This was the idea behind his theory. His theory, amazingly, was taught to medical students for over 2,000 years and was only replaced by the germ theory of disease causation during the 19th century. The germ theory, of course, of disease causation states that various microorganisms known as pathogens or germs can lead to the development of certain infectious or communicable diseases. He was a very futuristic thinker, I would argue. because he suggested that the development of disease or states of ill health might be related to features of the environment. So if you live near swamps, for example, he knew that certain individuals could contract malaria. He didn't know, of course, it was related to mosquitoes as we do now, but he knew that the gases and so forth were associated with states of ill health. And also the lifestyle of individual, heavy drinking of alcohol, excessive amounts of food, caloric intake, lack of exercise, all contributed to one's health and well-being as well. So this was very, quite futuristic thinking for his time. John Grant, in the 17th century, this is a time, here you see the bills of mortality, and this is the systematic recording of births and deaths that occurred in London. It was initiated in 1603, and it was referred to the bills of mortality. Grant systematically recorded information related to a person's age, their sex, and when the death actually occurred. And these demographic characteristics are in fact examples of descriptive epidemiology employed today in regards to person, place, and time, as we referred to in previous slides. He also discovered a certain numerical regularity of deaths and births, the ratios of males and females at birth and death, and the proportion of deaths from certain causes to all causes in successive years and in different areas. He was the first to develop and calculate life expectancy tables, or actuarial tables, as they are also known today. And he was the first to classify disease into two major categories, notably acute or chronic in nature. So acute diseases tend to be relatively severe in nature with a sudden onset, but have a relatively short duration. Example might be a flu or smallpox. Chronic diseases tend to be less severe in nature, but are continuous in duration and last, of course, long periods of time. And examples might be things like heart disease and diabetes and chronic obstructive pulmonary disease. Edward Jenner, he observed that dairymaids who often contracted cowpox tended to have less incidence of the more deadly smallpox. And if they contracted it, of course, their cases were often less severe in nature as well. What he did is he actually vaccinated an 8-year-old boy named James Phipps with cowpox from, these were pustule material, what he called the grease coming from the wound of these infected animals with cowpox, to provide immunity against the more severe and deadly smallpox. Immunization remains the most cost-effective public health intervention for controlling and managing a variety of vaccine-preventable diseases globally. So we know, for example, that every dollar we spend on immunization, there is a $16 return on investment, in fact, ROI, or a 1,500% benefit, if you wish. Smallpox, a little bit of a follow-up note on that. There was a worldwide global smallpox campaign that began in the late 1960s. And on October 26, 1977, the World Health Organization reported that they tracked down the last known case of naturally occurring smallpox in the world, who happened to be a gentleman residing in Merka, Somalia, named Ali Mau Malan, who was a hospital cook. And of course, this is an example of the effectiveness of global vaccination campaign, and actually smallpox has been eradicated. William Farr, he extended the use vital statistics as measures of public health and developed a modern population-based vital statistics system which served as the basis for recording vital health statistics globally. Today, a sort of an outgrowth of that is the ICD-11, the International Classification of Disease 11. Now it's in the 11th edition. So there's standardization of how we classify diseases, be it heart disease, the various types of diabetes, ischemic versus hemorrhagic stroke, etc. Globally, it has been translated into various languages and so forth. He also invented the standardized mortality rate, or SMR, which is a method for making fair comparisons between groups with different age structures. And we will talk more about these different types of mortality rates in the second part 2 of this lecture. He also advanced the notion that certain diseases, especially those which are chronic in nature, may have multifactorial etiology or causes. So it wasn't just one cause, as attributed to the germ theory, for example, but may have multiple causes, okay? It could be related to one's age and sex and environment and lifestyle and so forth. John Snow in the 19th century, and what was happening here, there was a lot of cholera outbreaks happening in England and other parts of the world, of course. And cholera happens quite suddenly. It's a potentially life-threatening enteric disease, and it's clinically characterized by very loose, watery diarrhea, vomiting. There is severe fluid and electrolyte loss, rapid dehydration, weakness, of course, for the patients. Their circulatory collapse may happen, and of course, if left untreated, death may occur. So on the basis of descriptive data and careful observation, Snow hypothesized that cholera was transmitted by sewage-contaminated water. So this was known as his waterborne hypothesis of disease causation. And here we see a map that he drew. This is on Broad Street in the Soho district of London, and it shows a water pump there on Broad Street. And Snow found that cholera deaths in London were clustered near this particular Broad Street water pump. Each of those little black boxes or blocks represents a death that occurred in a household there. So it was really a sort of primitive bar graph. We refer to this type of epidemiology as shoe leather epidemiology. You have to pound the pavement. He went door to door and he recorded where the deaths were actually recording. And he actually used a map of the city, sort of this cluster map, a very primitive early form of a cluster map, which is still being used today, obviously for tracking various outbreaks, to record deaths and get some sort of objective way of looking at where the diseases were occurring geographically. So he carefully researched and mapped his data where deaths were occurring in London by household and also by the specific water supply company. So he realized that some of the water supplies companies were either coming from an upstream source on the Thames River or from a downstream. And what he realized is those coming from the upstream source was actually cleaner. It would have less pollutants, less fecal material in the water, as in comparison to downstream sort of sources. And of course, this was very strongly associated with the number of cases of cholera in these households and also the number of deaths. Cholera today, we currently know that cholera is caused by eating food or drinking water contaminated with a bacterium that we call Vibrio cholera. Although Snow did not identify the specific bacterial agent, His waterborne hypothesis for the source of cholera had long-lasting public health consequences. So we know the importance of having a clean water supply, and also how we deal with the disposal of waste materials is critical because it affects people's health and well-being. Unfortunately, cholera remains endemic in many, mostly tropical regions of the world, in Asia, Africa, Latin America, India, and the Middle East today. And there are still various cholera outbreaks that still occur, mostly in these poor sort of districts and communities. The last sort of historical example I would like to talk about is Dahl and Hill's studies on smoking and lung cancer. Well, these researchers were really disturbed by the striking increase in the number of deaths related to lung cancer in males and females in England and Wales following World War II. So here I have a photo that I took of cigarettes for soldiers in hospital. This is in the city of Glasgow. So actually, during the wartime, tobacco companies were aggressively marketing cigarettes, and they were actually handing out cigarettes to soldiers on the front line. And of course, cigarettes are extremely addictive. Soldiers could smoke in hospitals, ironically, providing there weren't oxygen present. Of course, we can't do that today. And the reason we can't do it today, in part, is because of Dahl's and Hill's studies on the long-term effects of smoking and its relationship, that we know the long-term effects of smoking and its relationship to the development of lung cancer and other chronic diseases that we'll be highlighting in the subsequent slides. So during the 1950s, smoking was actually being endorsed by various healthcare professionals, such as physicians, to decrease stress and anxiety levels. And it was considered a social norm. So if you look at old films from the 1950s, from Hollywood and so forth, Casablanca and what have you, everyone on film is smoking. Okay? So here we see a couple ads. The one on the bottom is for Viceroys by Dentist here. And of course, another one by Camel, cigarette to the right here. More doctors smoke Camels than any other cigarette. Of course, physicians were, again, continue to be respected healthcare professionals globally and had lots of influence. And of course, using them in part of their marketing campaign was very effective, to endorse, to first of all, to encourage smoking, and it was regarded as a social norm. So it was thought by some that this increase was simply attributed to better diagnosis occurring through various technological innovations, such as the development of X-rays that moved into hospital settings. Here on the right, of course, we see an X-ray, and we can see cancer of the lungs, adrenocarcinoma happening here, cancer of the lungs. They reasoned that improved diagnosis could not be entirely responsible, especially in light of the fact that lung cancer mortality rates had increased in geographical areas in England and Wales that did not have these modern X-ray facilities. So something else had to be occurring. So why is Dahl and Hill's investigation so important for public health? Well, first of all, they identified that lung cancer may have important lifestyle risk factors in terms of smoking history, the intensity, and duration. Currently, the long-term negative health effects of smoking are well documented. However, little is known about the long-term effects of vaping, and that's something that public health officials and epidemiologists are certainly looking into today. Secondly, they incorporated changes in smoking habits over time in their analysis of the data, and therefore were able to objectively examine the health benefits of actually stopping smoking. So we know today that looking at 1 year after quitting smoking, a person's risk for developing coronary heart disease roughly decreases already by half. So that's an amazing finding, an epidemiological finding for that lifestyle intervention. Quit smoking, you decrease your risk for developing heart disease by half. After 10 years, a person's chances of developing lung cancer and dying from it is also roughly cut in half. So there are various benefits to actually, stopping smoking that are well documented in various investigations around the world. Also, the prospective nature of the study, that means moving forward in time, was critical in determining the development of various subsequent chronic non-communicable diseases associated with smoking that often takes decades to clinically manifest themselves clinically. Not only lung cancer here, but also things like heart disease and diabetes and other forms of cancer as well. Here's an additional suggested reading for you for part 1 and also for part 2 of this lecture series. It's chapter 6, Epidemiology, Essential Concepts for Public Health. In part 2 of this lecture, we will examine the role of epidemiology in public health as well. We will specifically examine the epidemiological triangle of communicable disease. We will also examine the updated and revised epidemiology triangle for non-communicable diseases. And we will also introduce you to various common statistical or epidemiological measures, things like prevalence rates and incidence, attack rates, various morbidity and mortality rates, relative risk, attributable risks, and odds ratios. Well, that's all, folks. I hope you enjoyed this lecture related to epidemiology, and I hope that you look at other lectures in this lecture series related to the art and science of public health. Cheers.